We have been monitoring COVID-19 very closely as the number of cases has increased in the state again. And we are wanting to make sure that we look very closely at the various communities that are at higher risk. The data are very clear that Latinos in California have increased risk for both being diagnosed, having COVID-19, but also having severe cases and deaths due to COVID-19. So it is a worrisome statistic when we see that we have, in particular age groups, the younger population, those that are younger than 50, where they comprise as many as 70% of the COVID-19 cases in the state. Also worrisome that overall in the state, about 45% of deaths due to COVID-19 are happening in Latinos. So the impact on our Latino community is quite significant.
Why do you think it's happening so much?
So there's a number of reasons that we can tease out from the data. First, I think it's when you look at just the occurrence of cases, why are cases occurring with greater frequency among Latinos? First, I think we have to look at occupational issues where we know that Latinos comprise a very large segment of the community that provides essential services, meaning that you have to go out to work. You don't have the luxury of staying home like some of us do. And when you go to provide these essential services, you are technically, exposing yourself to many other people out of necessity to do your job. And so, we know Latinos are heavily represented in the agricultural sector, getting all the food that we all eat, in the service industry, in restaurants, cafes, things like that. In the healthcare sector, actually, when you go to healthcare facilities, a lot of the support staff in those facilities are Latino. So we comprise a very significant portion. Therefore, our exposure outside our homes is greater. Number two, we have a situation where we know that if you're looking at severity of cases, Latinos have a high percent of comorbidities of other health problems that make you at high risk to get infected and to have severe disease. Diabetes, hypertension, heart disease, obesity, they all are pretty high in the Latino community. And when you have that and you expose yourself to COVID-19, you increase the risk that you're gonna get infected, but very importantly, that you are going to have severe disease and possibly complications. And thirdly, that we know that as much as California has made important inroads in improving access to healthcare, and Governor Newsom has made it very clear that anyone that has COVID-19 should be able to get healthcare whether or not they are able to pay for it. There's still some fear in our community for seeking healthcare. And when that happens, you delay seeking care at a time where you should be getting care for, and thus you increase the odds that you may get a severe disease and it's too late to help you. So we are reminding people that, if you get COVID-19, you have the signs and symptoms of COVID-19, fever, shortness of breath, cough, malaise, all of those things, that you reach out to your healthcare provider by phone and just make sure that they're aware that you have potentially COVID-19. You can get tested and confirm. But very importantly, if you develop signs and symptoms that are worrisome, like really severe shortness of breath, like you start turning purple, like you really cannot breathe, you get confused, those are signs and symptoms that you need to seek care immediately. Don't wait. And care is available, and nobody's gonna wonder whether or not you are here legally or illegally. They will take care of you.
I have a couple more questions. I know we're short on time here. Following up on the farm workers, why are we seeing that so prevalently with that group?
Yeah, I think with our farm worker community, I am very concerned because we know that they are, by the way that they live frequently in situations where they're very much close to each other all the time. We have farm workers that aren't able to live in situations where they can socially distance, physically distance from each other. So frequently they share housing. So there's many of them in one single house, in one single room. They get transported to their work in vehicles that also puts them in very close contact with one another. And as we have seen, they are not always able to practice social distancing, and I don't think that they are using face coverings to the degree that we should be using face coverings. So that really is a bad situation where you are that much in close contact with people all the time, puts you at very high risk. So we're really, I would like to remind our farm worker community that if you are not able to physically distance yourself at home, physically distance yourself when you've been transported or at work, to always ensure that you wear a face covering.
And one more question, and you kind of touched on my final question, is your advice, what will it take to turn things around in the Latino community?
Yeah, to turn things around in Latino community, I think we need to implement very common sense measures that I know are easy to say, but sometimes they are difficult to implement because it has an impact in how we live our lives. But at this point in time, I think it's a sacrifice that is well worth the price. So we need to make sure that we, stay home as much as we can. Certainly, if we leave the house, always wear face covering. If we're in the house and we're around people that are not our common housemates, to make sure we also have a face covering. Very importantly, make sure that we don't congregate at this time. That's just a really bad idea, congregating with people that you don't live with. I know we all love quinceañeras, we love birthday parties, we love weddings, we love going to church, and we love family picnics. Right now, it's not the time to do that if you're exposing yourself to people that you normally don't live with. So we're asking people to really minimize that social mixing with many people, that congregation in settings where you bring people from different places together. And I think that can go a long way. And thirdly, obviously remind people that hygiene, washing hands, frequently not touching your face is super important. I cannot stress enough that one easy way to infect yourself is to have contaminated hands and touch your eyes and nose. So easy things to do, but I know that we all sometimes forget about it. So remind people that if you practice those three recommendations on a regular basis, you will lower the risk of COVID-19.